Brought to you by CGTN Europe.
I'm Stephen Cole. Welcome to the Agenda podcast. So far, Africa appears to have been spared the worst of the COVID-19 pandemic. The virus is certainly spreading more slowly across that continent than anywhere else in the world. This week on the Agenda podcast, we look at why that might be. We also look at the economic impact of the virus on the continent. To discuss the effect the pandemic has had on African countries, I spoke to the World Health Organization's Regional Director for Africa, Matshidiso Moeti. Dr. Moeti, many thanks for joining us here on the Agenda. Trying to get an entire continent to self-isolate must be an almost impossible task, a Herculean task. How would you describe it?
Yes, I do think Herculean is a good word, but luckily this is a task that we are supporting governments to implement in countries. In fact, our region constitutes 47 countries, sub-Saharan countries plus Algeria. And of course, it was a very tough job to do for the governments. They started very early, I have to say, in most of the African countries, and heads of state put in place some sort of all-of-government cross-sectoral platform, the most relevant ministers who have to make decisions and make sure that action takes place around the measures that were undertaken, including those that deal with transport. Of course, the ministers of health were very much the secretariat of these groups. Those that deal with education, who had to make decisions about schools, those that deal with trade, etc. It was not easy. I think it's very important to stress that these were tough decisions for governments to take and to implement. And it was also tough very much on the people. So from the outset, I would like to appreciate African people's acceptance of the need for these measures, which were very much around supplementing some of the gaps in the public health capacities to identify cases, trace their contacts, and to isolate them, which is the core interventions for all of this. And we know that it's had and we think that implementing these early, implementing these comprehensively in quite a few countries has had an impact in slowing down the evolution of the pandemic in many African countries, even if we are continuing to see an increase in the number of cases. It's had a very severe economic impact.
Looking at the figures, the virus does seem to be spreading more slowly in Africa. And the reason for that, if I've understood you correctly, is that people have been obeying the rules. Is that right?
Yes, I think there are several reasons for that. Indeed, people have, to a large extent, responded positively and complied with these measures that were put in place by government. So staying at home, trying very hard, and it's been a challenge for African people in our way of living to do the social distancing when people are out together in families. And we know that in some circumstances, low-income families, peri-urban areas, keeping a distance from people is simply very difficult because of the circumstances. We also think, the virus arrived in Africa some weeks, in some cases months after it had arrived in Europe and, of course, in Asia. And the governments took action early. They were able to scale up some of the capacities pretty quickly. For example, at the beginning of February, we only had 2 countries that could diagnose this virus. And within a few weeks, we had established diagnostic capacity working with our partners and the governments in almost all of the 47 countries in the African region. In addition, in preparing for the Ebola outbreak, I would say that is just coming to an end in the north, in North Kivu, in the DRC. Most countries, almost all the countries, had already put in place this point of entry screening, particularly in airports. So it was simply adapting that for the needs of this COVID-19 that was carried out. And we've done a lot of work with countries in improving the way in which they address outbreaks. And African countries are needing to address outbreaks all the time of different diseases. So there was a basis already there. The Ebola had already started some preparedness activities going on. And then there was a need then to very quickly ramp up some key capacities like diagnostics to deal with the virus. And I also think that, if you like, the intensity of international travel in Africa might be less than in some other wealthier regions where people travel for business, for tourism, etc.
So those points are well made, Dr. Moeti. But I wonder, too, whether Africa as a continent has more important priorities than COVID-19. I'm thinking about widespread medical access to care and clean drinking water, these kind of priorities. Where would COVID-19 fit in that list?
That's a good question. And I think it's very important to emphasize that it's not a matter of either or. We have to deal with all of these priorities at the same time. You know, when you have a pandemic like this, which is so threatening, it does soak up, I would say, a lot of attention, a lot of the resources, simply because it also has an impact on a country's ability to respond to the other priorities. So if we have to help country to provide basic health services, immunization for children, family planning services for women, making sure that mothers are delivered safely, the need to do that without creating the opportunity for transmission of the COVID-19 then presents an additional challenge. So countries need to address these at the same time, and we need to find opportunities in some of the work that's being done to respond to COVID-19 to also deal with the laboratory needs of the other diseases, for example, and find ways of integrating laboratory systems so that you can have your COVID corner, your yellow fever corner, and find ways to leverage some of these resources. That's very much the way in which we're supporting countries to work. But it is very much a difficult way of trying to make choices. And we're trying to ensure with partners like Gavi and the Global Fund that countries have the resources to address these multiple priorities at the same time. Yeah. It is not easy, I have to say.
Of course not. Again, I'm going back to the numbers, Dr. Moeti, and Africa has about 17% of the world's population, but only about 2% of confirmed cases. How much of that do you think is down to a shortage of accurate testing?
Yes. As you know, there's been a global crisis, I would call it, in access to the supplies for testing all over the world. And because the virus arrived in African countries later, as the spread was happening, then this problem with having access to testing kits particularly was becoming more and more acute. But, you know, African countries had already established a way of responding to alerts before we started getting cases in the region. And I'm aware that thousands of alerts were tested and eliminated at the beginning. And then secondly, I think that the point of entry screening that I mentioned, the fact that everybody who arrived in an airport was having their temperature checked and their details collected and noted by the transportation travel authorities in countries, made it possible for tracing cases and their contacts to be relatively easy in African countries. So the platform had already been established for this. It is true that if you look at the rate of testing across most African countries, it's less than has been the case in other countries, particularly due to this shortage. But I'd like to say a couple of things that make us understand there is a degree of underestimation, of undercounting of cases, we think, but we do not think that we have very large numbers of people who are undetected as cases and who may be dying of this disease. We have an influenza surveillance system in almost half of the countries in the region, which is keeping an eye on flu-like symptoms and cases. And we have not seen a huge increase in this, which would make us understand that some of what might be thought to be flu is in fact COVID-19 simply because we can't test for it. And we've seen a number of countries like Ghana and Senegal significantly increase their testing without a commensurate huge increase in the number of cases that are detected. South Africa, of course, is a country that's tested the largest number of people, and there they've seen a significant increase, particularly in the hotspots of Cape Town, Johannesburg. So to conclude, we have systems in place that can carry out some sort of proxy identification, certainly on a clinical basis, of what could be COVID-19. And in one case, in Kano State, when people in the community started seeing a number of cases of this unusual illness, they reported this to the national authorities. So in many of the countries, we have at the community level, community health workers, and in countries that have had outbreaks, people are sensitized to alerting the authorities of an unusual pattern of illness, which also triggers then the alerts and investigation by governments.
So a good alert system, but as you say, there has been a degree of undercounting. I'm looking at evidence from the Partnership for Evidence-Based Response to COVID-19. Now, that's, as you know, a public health consortium, and it's been noting, in quotes, the true number of infections is likely to be far greater than is currently known. Its estimate, and it's a rough estimate, I agree, suggests a tally 8 times higher. Now, would that figure tally with the World Health Organization?
We've done some projections of what would be the numbers if the public health measures weren't working, if there was widespread community transmission in African countries. I actually don't believe that we could have 8 times the number of cases that are being detected in countries. It's not possible to say by what degree we estimate the, if you like, the underestimation to be. But from the work that we are doing with our colleagues and from the knowledge that we have of the type of testing that's being done, I don't think that it's as great a degree of underestimation as 8 times.
And lastly, Dr. Moeti, as we've agreed, Africa seems to be suffering a slower pandemic than Asia and Europe. But how would you describe the potential for risk of the spread?
I think the potential for risk of the spread continues to be there. We've had the measures that were put in place by governments are not measures that you can sustain for any length of time, and many governments are already working on easing some of the social and physical distancing measures. The virus is still there. The health systems of these countries, despite all the efforts that has been made to scale up, if you like, public health measures beyond the capital cities, continue to be relatively weak. And really, until we have a vaccine which is available and accessible in these countries and can be deployed quickly, targeting the most vulnerable people, the risk continues to be there. So our estimation is that countries will need to continue to put in place and scale up and expand these measures to identify cases quickly, very quickly identify their contacts, and build the capacity to isolate these until they are no longer infectious to other people. So we'll have to live with this way of working. This is not like an outbreak that finishes in a few weeks. It's something that will continue for some time, as I said, until we really start to have the most effective tool, a vaccine, we hope, available to be deployed in the countries.
Of course, the COVID-19 pandemic is not only having an impact on health in Africa, but also on the continent's economy too. And many are worried that as the world's largest economies adopt increasingly protectionist measures to boost their own domestic economies, trade with developing countries will only suffer. Well, to discuss the virus's economic impact in more detail, I'm joined now by Dr. Dirk Willem de Velde from the Overseas Development Institute. Dr. de Velde, how would you describe the impact of the virus on trade in Africa?
Well, thank you. There have been major devastating effects on trade in Africa. The effects were already beginning to be visible back in February when there was an initial slowdown in China. There were major effects on global commodity prices, including oil prices, and the major oil producers in Africa like Nigeria and Angola, they were suffering in a major way. But then by, I would say, March, the global recession was coming. There was a global impact. And by then, we're beginning to see orders for garments drying up. We were seeing that flowers wouldn't be able to be sent to Europe, and they were actually rotting on Kenyan flower farms, on Dutch auctions. And so there's been a major effect. The hotel bookings were collapsing, tourism ceased. So all in all, there's been a major effect on trade. But I would also say that capital flows have also been falling. And so like foreign direct investment is expected to fall by 25 to 40% this year. Remittances is expected to decline by about 20%. And whilst there's no financial crisis yet, there are some devastating effects. And we estimate that overall, the shortfall through trade and finance in Africa will be at least $100 billion this year. And in sub-Saharan Africa, that is more than 5% of GDP.
The cruel irony, Dr. Te Velde, is that before the pandemic, things were looking up for Africa. Trade was increasing, poverty was falling. Is it possible to estimate how long it might take to those pre-pandemic situations across the continent?
Well, in terms of poverty effects, as you mentioned, we will now see an increase in poverty numbers, headcounts in Africa. And that's been there after a long period of declines in poverty headcounts. And we will also now see the first recession in Africa after a long period of growth for more than 25 years. And so we will see about 5 to 10 years of development gains just being wiped away by one event.
And that brings us to the end of another edition of The Agenda. You can subscribe to this podcast on iTunes, Stitcher and Spotify. You can also find us on CGTN Europe Facebook, Twitter, Instagram and YouTube.
The most interesting questions.
Are there other living beings beyond Earth?
Will man or machine be in charge?
Great question.
Always have more than one answer.
Well, hold on, let me just draw up a list.
And always come from more than one person.
That's where the credibility lies.
The concept of having a machinery which is alive and evolving didn't wait for us.
The end of inequality of incomes and wealth around the world, can you imagine how difficult that is at the moment to achieve?
Every episode, Stephen Cole, Murray Beveridge, and some of the brightest minds out there shed light on the answers to some of the most intriguing questions.
There are two ways of looking at this.
Machines can't really discriminate between civilian and military targets.
The Answers Project.
Maybe we need to just look at this in a bit more detail.
Extraordinary claims require extraordinary evidence.
The Answers Project, a new podcast from CGTN Europe.